Dr. Conaway, when a woman with fibroids comes to Clarity Care, what symptoms has she been experiencing?
Well, so there's a variety of symptoms that most women have, but the most common is heavy menstrual bleeding, also menstrual pain. There's pelvic pressure is a very common symptom, discomfort during intimacy, urinary frequency, constipation, bloating. Those are the most common symptoms that will occur.
What options does she have to treat her fibroids?
So many women will have seen and talked to their primary care physician or gynecologist. They'll have tried medications, hormonal therapies. They have probably been offered, at least some of them, hysterectomy or major surgery. And then the newest and most exciting thing, but it's been around for decades, just many women aren't aware of it, is uterine artery embolization, or UFE.
Nice. Why would she choose UFE over surgery other than other treatments approaches?
Yeah, sure. That's a great question. Most women are choosing uterine fibroid embolization, or UFE, because it's minimally invasive. They get to go home that day. They're back to normal activities usually within a week, and their symptoms are going to improve over weeks, and they can have a normalized life without removal of their uterus and major surgery.
Oh, that's awesome. How is the UFE surgery performed?
So it's performed through a tiny opening over the hip. We insert a small tube that goes into the arteries of the uterus, and we reduce the blood flow to the fibroids, which causes them to shrink over time. And because of that shrinkage, their symptoms improve as the fibroids shrink.
How soon after the procedure will she start to see her symptoms improved?
So menstrual symptoms are some of the first things to improve, and those and pain associated with menstruation improve over the first several cycles after the procedure. Because many of the other symptoms that we call bulk symptoms, like the urinary frequency, the pelvic pain, discomfort during intimacy, those are going to improve with the shrinkage of the fibroids. Fibroids will shrink from 3 months to 24 months, and as they shrink, those are when those symptoms improve the most.
What is the success rate of UFE, and what are the results long term
So,
and long lasting?
Yeah. Uterine fibroid embolization, or UFE, has been studied for decades, and there's a lot of scientific evidence regarding them. Not to get too deep in the weeds about that, what I'll just say is that it's been proven to be highly effective, and women have long-lasting treatment results.
Nice. Is UFE covered by insurance?
So insurance is complicated and every policy is different, but insurance, most major insurances have covered UFE for many, many years.
How can a woman with fibroids concerns seek treatment at Clarity Care? Does she need a referral?
So referral is an insurance question, and we're going to walk patients through that if they need that, and we'll help them get that if needed. But the easiest way to access us is probably kcfibroids.com, or they can Google claritycarekc.com.
Tell me, why choose Clarity Care?
Yeah, so at Clarity Care, what we do is specialize in minimally invasive treatment options for the patient. So they get to come to us and seek convenient access to their dedicated team who specialize in minimally invasive outpatient procedures where they get excellent care, easy access, and we'll walk them through all of the things that you're talking about, including insurance coverage, what they might owe if they owe anything, and getting approval, referrals, all of those kinds of things. So we're really here as their advocate in the healthcare system.
Nice. What advice do you have for women seeking an alternative to surgery to treat fibroids?
My advice to women is to seek out other options. Many women are surprised to find out that there are minimally invasive treatment options for them They've been told that major surgery like hysterectomy or living with it is their only option. And I want them to know that although heavy periods are common, they're not normal, and no woman should have to plan their life around their periods.